Welcome back. Joining me now is Dr. Christina, a pediatric pulmonologist at UT Health East Texas and an associate professor of pediatrics at the University of Texas at Tyler School of Medicine. How are you?
Good. Thank you for having me here today.
Yes, thank you for joining us. So can you tell us about what asthma is and how common it is in children?
Yes, so asthma is a chronic condition in which the small airways of the lungs become inflamed, swollen, and sometimes more narrow at times. And when that happens, kids can get wheezing, cough, shortness of breath, and sometimes chest tightness. Although it is more common in older children, it can occur at any age, and even babies can sometimes get asthma in rare cases. About 1 in 12 children in the United States have asthma, so that means in a typical classroom, probably about 2 to 3 kids are dealing with it. The good news is that asthma is very treatable though, and so with the right treatments, most kids with asthma can run around, play sports, and do everything their peers can do.
Yes, and now I know you've already mentioned a few of them, but what are some signs of asthma that parents might not recognize?
Yeah, so while most people think about wheezing or even trouble breathing when they think about asthma, cough, especially a nighttime cough or a cough with exercise or laughing really hard, can be another sign of asthma. Another sign of asthma can be if a child has more severe or prolonged respiratory symptoms with a respiratory viral illness, and if their symptoms seem to last longer with respiratory viral illnesses compared to other kids their age. Some parents of children with asthma come and tell me that anytime their child gets sick with a respiratory illness, the symptoms go right to their chest. Another thing to look out for would be if your child becomes more winded when they're running around, or if they have more difficulty recovering when they're running around compared to other kids. If those things are happening, it might be worth talking with your child's primary care provider.
Yes, and so are there particular things in our environment that affect kids with asthma?
Yes, and here in East Texas we have several of them.
Yes.
And so pollen, humidity, mold can all be triggers for some people with asthma. Asthma can be a little bit tricky because the symptoms can vary over time and the triggers can be different depending on the person. So some children have a lot of seasonal allergies, so their asthma gets worse during times that the pollen counts are high. Other children are more triggered by respiratory viral illnesses, so they may be totally fine when they're healthy, but anytime they get a cold, they may develop a severe cough or even trouble breathing. And then smoke can also worsen asthma.
Yes, and so what are the typical treatments for asthma?
So kids with asthma will be prescribed an inhaled medication first to help open up the small airways of the lung. Asthma has many different treatments, and the delivery devices for asthma medications can be different, and the way to administer them can be different. And so if a parent is not sure how to use the delivery device that has been prescribed for their child, they should talk to their child's medical team or pharmacist. The other good thing is a lot of asthma medication websites have tutorials on their websites to show how to properly use the delivery device.
Yes, and so what should a parent do if the suspect to that child may have, or do they suspect their child may have asthma?
So I'd recommend that they first talk with their child's primary care provider, as they are very experienced in managing asthma. If after that initial evaluation and treatment, a child is still having a cough with no improvement after 4 weeks, if they'd had to go to the ER more than one time for breathing issues, if they've been hospitalized for their asthma, or if their symptoms still aren't getting better with asthma treatment, that might be a time to see an asthma specialist, like a pediatric pulmonologist. We have special tests and tools that we can use to evaluate children with breathing issues, and we work closely with the child's primary care provider to give them the treatment that they need. There can also be other causes of coughing and wheezing besides asthma, so we can evaluate and treat those as well.
Yes, and if parents take away just one thing from this conversation, what should it be?
So I would say if your child's asthma is preventing them from doing the things that they want to do, please talk to your child's medical team about that, because asthma is very treatable and kids with asthma should be able to run around, do sports, sleep well at night without trouble. We want kids with asthma to be able to be kids and not worry about their breathing.
Yes, and real quick, so running out of time, how can folks who are interested in pediatric pulmonology services in our area learn more?
Yes, so they can go to our website or they can call our clinic directly.
All righty. Well, thank you so much for joining us today.
Thank you so much for having me. I really appreciate it.
Yes, and for more information, you can go to that website right there on your screen or call the phone number.